Alright, this is the third in a series of recordings for the posterior abdominal wall, and in this one we're going to be focusing on the kidneys and the adrenal glands themselves. So these are the objectives in orange that we're going to be covering. So first we'll start off with some key anatomy of the kidneys and the adrenal glands, starting with the kidneys. First of all, the kidneys are a retroperitoneal organ, and what that means is that they are located behind the parietal peritoneum. Okay, so they are not inside the peritoneal cavity, and so you can see that in the diagram on the left. They're outside of the peritoneal cavity. Other things to note, the right kidney is lower than the left kidney, and that's because of the presence of the liver. Large space-occupying organ, so it pushes the right kidney lower. And you can see the levels listed on the slide. The hilum is a structure where or is placed in the kidneys where structures either enter or leave the kidney tissue. So in this case, the structures we're talking about are the renal vein, renal artery, and renal pelvis / ureter. And they tend to, from anterior to posterior, to be oriented in that order. So most anterior is the vein, then the artery, and most posterior is the pelvis. There can be some variation, but that's typically the orientation. So look for that in the lab. In terms of the adrenal glands, they sit on the superior pole of the kidneys like a cap. However, it's important to note that they're not directly attached to the kidney. There's actually a layer of fascia that separates the two, so that it is just sitting on top. The adrenal gland has two parts, an inner or central medulla, which is producing the epinephrine, norepinephrine, and then there's an outer cortical layer, which is producing the corticosteroids and androgens. Alright, it's important to know a little bit about the fat and fascia layers of the kidneys because it does have some clinical implications, particularly related to infections. So the first layer that's immediately surrounding the kidney is known as the perinephric fat. Then, immediately surrounding the perinephric fat is a thin layer of connective tissue called the renal fascia, and so it encloses the perinephric fat. And then finally, just sitting outside of that the renal fascia is another layer of fat that surrounds the renal fascia called the perirenal fat. And so all of these layers help to insulate, support, provide energy, and protection to the kidney. Alright, we talked about the vasculature, the blood supply and venous drainage of the kidneys, so I'm not going to go over that too much, but I just want to highlight again the right renal artery coming off the aorta is actually going to travel behind the inferior vena cava on its path toward the right kidney. And then I would just again highlight that the left adrenal vein and the left gonadal vein, whether that's testicular or ovarian, drains into the left renal vein because that's a longer vein. And because the IVC is shifted to the right, you have this different venous drainage pattern. Alright, some relationships of the kidneys and the adrenal glands. They're all listed here, and so I'm going to use a figure to highlight these things. So lots of stuff happening in this image, but hopefully you can connect the dots, take your time, and figure this out. So sitting anterior to the kidney, to the right kidney, are the ascending colon, transverse colon, and you can see the outline of the liver in this diagram, as well as the duodenum. So those are all sitting in front of the right kidney. Anterior to the left kidney, you have the transverse colon. As it crosses over, you have the descending colon. The stomach, which is highlighted with the blue circle, is sitting just in front of the kidneys, as well as the pancreas as it's crossing the abdominal wall, posterior abdominal wall, and the jejunum, which is the part of the small intestine, is sitting right in front of the left kidney. Excuse me. Posteriorly, so sitting behind the kidneys, we talked about this a bit, but the psoas muscles, the quadratus lumborum, as well as the 11th and 12th ribs are closely related to the kidneys. Sitting superior to the kidneys on the right side is the liver, most obviously, and then the right adrenal gland is sitting on top. And then on the left side, the spleen is sitting immediately on top of the left kidney, and that's highlighted by the purple circle. Medially, so sitting medial to the right kidney, you can see the inferior vena cava is just medial. The duodenum, because of its C shape, is sitting medial as well to the kidney. And the pancreas, which is sitting within the C-shaped structure of the duodenum. On the left side, the pancreas, as it's again crossing across the posterior abdominal wall, is sitting medial to the kidney as well. So those are some of the important relationships of different structures to the kidneys. Alright, so the urinary tributary system. So this is the kidneys are producing urine, and so the tributary system is that system that's carrying the urine away from the kidney down to the bladder. So first, again, just to understand things a little bit, the nephrons, which are the basic filtration units of the kidneys, are located in the cortex, the renal cortex. So that's the outer margins of the kidneys, and so you can see renal cortex highlighted in black. So that's where the urine is filtered, and then the nephrons connect to collecting tubules, which are found in the renal pyramids, which is highlighted in red. So it's a sort of a pyramid or triangular shaped in this image structure, and there are many of them in the kidney. At the apex of the renal pyramid, you have the renal papilla, which is highlighted in orange. And here, the urine is going to drain into a minor calyx. So each papilla is going to drain into a minor calyx. And there are several minor calyces for each pyramid that are ultimately going to unite to form a single major calyx, which is highlighted in blue. And then there are several major calyces that are going to unite to form the renal pelvis, which is highlighted in purple. The renal pelvis is going to narrow down and become the ureter, which is ultimately going to travel to the bladder. So that's sort of a basic, gross perspective of the tributary system, and hopefully in the lab you'll be able to see these things and picture it a little bit better in the lab. So the ureter is coming off the renal pelvis, and it is descending down into the pelvis itself. So as they descend to the bladder and the pelvis, they travel along a number of different structures that have important relationships. So as the ureter is descending in the posterior abdomen, it is running along the top of the psoas muscle. Then when it gets to the pelvis, it's going to cross over the pelvic brim, which is highlighted in yellow, and you can see that it's crossing over top of the external iliac vessels. And the same thing would be happening on the right side. So understanding those important relationships is important as the ureter is descending down into the bladder. And we'll finish that course when we talk about the pelvis. So by way of summary, we talked about some of the basic anatomy of the kidneys and adrenals, some of their important relationships, the vasculature, spent a bit of time in that tributary system, particularly focusing on the ureter and its course.